On September 12, 2012, it was just an ordinary day for stroke victim Robin. The nurses bring her breakfast, get Robin ready for the day, and then walk her down to the therapy room. After a tragic stroke last month, Robin was unable to move her left arm. She sat there in annoyance as she was sick and tired of all the therapy. She knew that she would never be able to move her arm again, and that was that. All of a sudden, she sees dogs walking in. She is puzzled by what is going on and perks up a little bit. Then a man walks over and asks if she would like to see Lucy. She eagerly nods and strokes the dog's soft fur and begins to remember her old Australian shepherd she had as a child. The psychologist stares and after 40 minutes walks over to the little group. "Robin," she says, "do you know what you've been doing the last 40 minutes?" Robin shakes her head and continues to pet the dog. You've been petting Lucy with the arm that was affected by the stroke for the last 40 minutes. "I have, haven't I?" Robin says with an ear-to-ear smile, reports Steve Dale of Chicago Tribune. Animal-assisted therapy is a revolutionizing new type of therapy that is becoming a part of many doctors' works. According to Dr. Thomas Highwood, a specialized cardiologist of extreme heart condition states, "If I could put a dog in every room, I would, due to the natural healing effects that animals have on humans. As a college student planning out their career, I believe in animal-assisted therapy, and that is why I plan to incorporate it into my practice as a clinical health psychologist." Clinical health psychologists play an active role in research, and there needs to be more research to figure out how individuals respond to different scenarios. So today, we are first going to develop an understanding of what a clinical health psychologist is. Then we will see the application that clinical health psychology can do for others. And lastly, we will explore deeper into the implications of my career choice. According to the American Psychological Association, clinical health psychology applies scientific knowledge of the interrelationships among behavioral, emotional, cognitive, social, and biological components in health and disease. Throughout all of these components, the overall goal is the promotion and maintenance of health, the prevention, treatment, and rehabilitation of illness and disability, and to improve the healthcare system. Clinical health psychology requires an understanding of biology, pharmacology, anatomy, human physiology, pathophysiology, and psychoneuroimmunology to help the patients get through the disease or illness they are suffering from. Clinical health psychologists use a broad array of procedures, including assessment, diagnosis, consultation with psychotherapeutic approaches, and techniques in the context of physical illness and health promotion. With expertise in research and methods, clinical health psychologists may also conduct research after developing understanding of what a clinical health psychologist is. Let us explore the applications of clinical health psychology. Clinical health psychology has already impacted an array of major chronic diseases, including AIDS, cancer, heart disease, chronic pain, and diabetes. In addition, clinical health psychologists evaluate and treat patients with acute health problems such as after surgery or a painful procedure. The psychologist helps influence new health behaviors such as getting the patient to stop smoking or influence their weight. Also, the psychologist impacts the response and recovery from physical illness, injury, or disability. According to Dr. David Moore in Perceived Barriers of Psychological Treatment, published July 21, 2010, the main barrier is the patient's mind. The main factors that affect a patient's recovery are the stigma, lack of motivation, and emotional concern. After exploring the application of clinical health psychology, let us look at the implications associated with clinical health psychology. Dr. Joan Brannick and Dr. Christine Banks, in Implications for Psychology, believe that psychology will be evident in all aspects of life in the future. Health psychology will be about preventing diseases and illnesses and learning to incorporate technology into the field. Psychologists are incorporating animal-assisted therapy or music therapy to help their patients. The field is evolving in many ways, and in the result, many individuals are responding to the therapy. To engage in this type of work, you need to be a hard worker and willing to attain a doctorate in clinical health. This type of psychologist needs to be versatile in their studies, as they should have knowledge pertaining to how we learn, how the memory works, the way people perceive different situations, and how to motivate someone. In addition, the psychologist needs to have motivation to never give up and have superior communication skills. Finally, after developing an understanding of what a clinical health psychologist is, seeing the application of clinical health psychology in people's lives, and lastly exploring deeper into the implications of my career choice, we can see that clinical health psychologists are playing an active role in helping people overcome obstacles. Overall, communication is key in the success of this career. Without it, people would not be able to overcome the obstacles and would be forever stuck. Take Robin, the stroke victim, for example. Robin and the dog were engaging in nonverbal communication by the affection being exchanged between one another. Robin was given a sense of comfort and therefore resulted in being able to move her stroke-affected limb. It's a little far-fetched, even for dog standards, but still, communication is key for success. Thank you.